Before I talk about payment methods, I want to talk a little bit about the payment balance that takes place in healthcare. When we talked about the different types of healthcare plans, we talked about, why employers and why employees like health insurance. But now let's talk a little bit about that payment balance. When we think about healthcare payment balance, we're thinking about it giving the right care. So giving the right care at the right time, giving the right type of care, giving care in the right way at a minimum cost. Because 5% of those who are insured account for 50% of the healthcare dollars spent in a typical organization. So we want to try and encourage more health for the healthcare dollars spent. And that's a nice segue into talking about different types of payment methods in healthcare. Payment methods are different than payment levels in healthcare. There are many different types of methods and levels of payment, and both are typically negotiated between healthcare provider and insurers with limitations and regulations then set by government payers, typically Medicare. So the essential difference in the 8 basic payment methods that are talked about in the article that you read divide the financial risk between the payer, the insurance carrier, and the provider, the hospital or physician. So this is a breakdown of these 8 different types. And what I'm going to do is I'm going to break it down a little bit differently. So this chart is in your book. So I think the best way to approach payment methods is to break down the language that insurers use versus the language that physicians' offices typically use. So when we look at the insurer language, we've got payment per year, payment per beneficiary, payment per episode, essentially. Payment per year would be like a budgeted item. Like maybe we have an on-staff physician or something that the insurer pays for. So that's basically someone's salary. A payment per beneficiary is per head of patients. So you might have a panel of patients, say you've got 5 patients that come from APME, and the insurer may reimburse that primary care physician on a per person basis, not per service. So you may see, Jack, Joe, Jill, Jenny, and George. I know George doesn't typically start with J, but you may see these 5 people, and Jack may go in 5 times in the calendar year to go to the doctor. Jenny may go in 20 times. That doctor is going to get paid the exact same amount whether he has Jack or Jenny. And the purpose of that is to take away some of the incentive for extra testing and unnecessary testing to get to results for a patient. For example, you may execute 5 tests that you could have really done in 1 test because you'll make more money as a physician that way. But then again, it's bad for situations where we have, as one of the videos pointed out, bird flu outbreak where you've got patients coming in multiple times. So payment on a capitation basis is per person, not per service. Whereas payment as an inpatient stay or an episode is broken down to represent the episode or an inpatient stay. For example, if you're in the hospital for hospital stay, you'll be paid a daily rate, or your insurance carrier will pay a daily rate to the hospital for the services rendered, not necessarily on a breakdown of the services, for feeding you and for taking your blood pressure and vitals and having the hospital doctor come and visit you. Some of those things are all captured in one payment. So physician office language, on the other hand, would use words like itemize. So fee for service, they would itemize each individual service, x-rays, evaluation, diagnoses, etc. Capitation, again, is still a panel per person for the per person patients. And then a salary is used by larger practices to pool costs, but again, it would be similar to the payment per year where we have a comprehensive care and comprehensive budget being used on an annual basis. All right, so now we're going to dive into Section 125 plans. And I love Section 125 plans because if an employee knows how to navigate these plans, they're in a really good place, and their employer's done a great job of setting them up as an employee to maximize their tax benefit. So anyone that can navigate open enrollment and walk away with employees understanding Section 125 plans and the tax implications is doing fantastic work. So let's take a look at what in the world is a cafeteria plan. So cafeteria plan gets its name because it gives you options, right? Like a cafeteria style would. So they come from Section 125 of the IRC, and it's basically a written plan that provides employees an opportunity to receive certain benefits on a pre-tax basis. So it operates in connection with other benefit plans offered by the employer, and it's essentially an umbrella or shield from taxation. So that's why I have the umbrella up there. So the essential concept in understanding a cafeteria plan is recognition that the cafeteria plan is really an umbrella in which the tax-favored employee benefits are offered. The cafeteria plan is merely a mechanism to pay for employee benefits in a tax-free manner. So prior to the enactment of the IRC, the tax treatment of benefits was quite different. If the employee had the type of choice in electing available benefits, there was this doctrine of constructive receipt that required the participant to then be taxed, even if the benefits were paid for by the employer. So really taking away a lot of the advantage of offering benefits to your employees. So Section 125 was added to the IRC around 1978 to offer these benefits. And you'll see the type of benefits that are covered would be accidental death and dismemberment, group term life insurance, and there's a cap on that of $50,000, I believe. So when you go to your employer and you're looking at your benefit package and you see they're only offering $50,000, you'll know why. It's not some arbitrary number. It's literally capped out by the plan. If you have a group term life insurance that exceeds $50,000, we covered up to $50,000 under the cafeteria plan and then pull the rest out, to be rained on by the tax gods. Dependent care FSA, and FSA, remember, are two different things. So you have healthcare FSA, and then you have dependent care FSA. And dependent care FSA covers for dependents who are receiving either at an adult daycare or child care facility, receiving some sort of care that you get to then take out money the same way that you would do for your healthcare FSA. The only difference is there's a monetary difference in the amount of money that you get to take out. I believe with dependent care FSA, it's $5,000 per household. So even if you have a spouse, the most that can be taken out for the entire household is $5,000. If your spouse is also using cafeteria plans, it's only $5,000 for the entire household. And then adoption assistance programs, and then POP are premium only plans, so that you can write off your healthcare premium. So things that are typically not covered under the Cafeteria 125 plans would be tuition reimbursement. So we're seeing a lot of emerging issues and emerging benefits around tuition reimbursement. And so that's not usually covered under the Cafeteria 125 plans. Dependent life insurance, again, not protected by the shield. Parking, employee assistance programs, which we'll talk about later, and then moving expenses, all things not shielded under the Cafeteria 125 plans. So here's your traditional benefit structure. The employee after-tax contributions, benefit A, employer contribution, benefit B, maybe they're paying 100%, and then the medical plan that both the employer and employee are paying. The employee's paying after taxes. And this is kind of the comprehensive cafeteria approach, where we start to see some pre-tax contributions come into play and explaining exactly the same thing that I explained in previous slides. So why have Section 125 plans? What are the policy reasons for having it? Well, there was a need to control high cost of employee benefits so that we could keep attracting a talented workforce. Preferential tax treatment was a huge win for both employers and employees. And then a flexibility and wider array of potential benefit designs, having a lot of different options under that Cafeteria 125 plan. And a cafeteria plan maximizes the value of the benefits dollars, and really it allows employees to select benefits that are good for them and their dependents. So here's an example of how something might play out in a Section 125 plan. So your monthly salary, $5,000. All of this amount, if we taxed it at 20%, we'd say your take-home pay would be $4,000. Now, let's take a look when we add a benefit that is captured under Section 125. Same monthly salary, only this time we're going to take out our benefit on a pre-tax basis. We're not going to pay it out of that $4,000. We're going to pay it off the top of that $5,000. So maybe it's a medical, dental, vision premium that we're subtracting before the tax. So we're taking out $500. So now our Section 125 taxable salary is not $5,000, it's $4,500. Same tax bracket of 20%, only this time we're only taking out $900, which means that my take-home pay is $4,100. Now, $100 a month doesn't necessarily sound like a ton, but that can add up over time. And of course, the larger your salary, the more money that you end up saving. And so I saw an example earlier that was on YouTube, and I think the employee only made like $23,000. And so it ended up being like a $200 a year savings. But again, that's $200 that you didn't have in your pocket. So $200 that can go into savings, that can go into investments, and the game goes on. So what are some of the advantages to employees? Well, the biggest advantage to employees receiving benefits under Section 125 Cafeteria Plan is, of course, the preferential tax treatment of these benefits. So employees directly save money since they pay for their share of benefit expenses on a tax-favored basis. So contributions to the Cafeteria Plan are exempt from federal income tax, including Social Security, so they're paying less into FICA, less into federal unemployment taxes, and most state and local laws follow that same favorable tax treatment. The primary disadvantages of Cafeteria Plan is the fact that the benefit elections generally have to be made prior to the beginning of a company's benefit plan year, open enrollment period. So which one of us knew that Corona was coming back last October? None of us. So how could we have planned for such an event, such a health crisis, so to speak, that far in advance? None of us could have. So we don't have that predictive modeling. Of course, that's what some of the CARES Act and some of the other acts that came to help address. Because, for example, for myself, my son's preschool shut down. So those were months that I was paying into my dependent care, or could have been paying into my dependent care and not receiving those services. So what the CARES Act, and I think it might have been another act, allowed us to do was to stop that as having a qualifying event and allowing me to stop contributing to that benefit for a little while until his preschool picked back up. Because again, remember, at the end of the year, if I don't use those funds, I lose them. Another tricky situation would be, I have a friend that's recently divorced, and she's currently paying for childcare, and maybe next year her husband will be paying for it. So they've got to figure out what's the best model then for her to be able to use that dependent care FSA, or FSA in general, if they're going back and forth between who's carrying health care. The benefit elections are irrevocable during the period of coverage. So like I said, normally this benefit is for a period of a year. So when I go into my open enrollment period in October or November for my plan period to begin January to December, there's only a couple of exceptions that allow me to go into my system and change that election. And usually it's the birth or death of someone in the coverage that's covered, or another kind of qualifying event. And so this year they allowed Corona to count as a qualifying event. Or I guess events resulting from Corona. It doesn't necessarily say Corona. And since there's no Social Security taxes being paid on the Cafeteria Plan benefits, the employee could realize a slight reduction in their Social Security benefit upon retirement. So that could be a bad thing, depending on how much an employee is going to rely on their Social Security benefit. And remember, most of these plans are set up, particularly flex spending and dependent care flex spending, are set up in the tax code to be use it or lose it. And the benefit that's been given back is that there are a lot of grace periods built into this. So some employer advantages is that there's a significant financial advantage in that the employer realizes payroll cost savings because the employer doesn't pay FICA or food taxes on those amounts that the employee contributes to the cafeteria plan. So similarly, where the employee sees some benefit in the reduction of having to pay into FICA and FUTA, so does the employer. In addition, deferral amounts are not considered wages for the purpose of determining worker compensation premiums and other payroll-based expenses. State and local tax treatment varies, but many states offer the same preferential tax treatment at the federal government level, as the federal government does as well. So this flexible benefit structure can help control escalating benefit costs, minimize the financial impact on individual employees, and create a greater awareness of overall value to their benefit. If the employee was the only one benefiting, how much do you think the employers would emphasize this? Probably not as much, but the employers also receive some benefits. So that serves as an impetus for employers to want to provide employee awareness around this area. So there's a couple of disadvantages to employers sponsoring a cafeteria plan, the biggest of which is going to be the cost of administration and operation of those cafeteria plans. And although costs can be upset to a certain extent because you're not paying the payroll taxes, the employer has to be mindful that the establishing and operating a cafeteria plan involves a lot of heavy administrative complexity and compliance with a lot of tax laws. So if you don't like tax laws, this is not the way to go. Adverse selection becomes a greater risk simply because unhealthy employees can select the most comprehensive insurance coverage, and more healthy participants can select the minimum health care coverage. So this can lead to an overall increase in the health care plan itself. So an employer has to be prepared to deal with negative reactions and criticisms for employees when establishing these cafeteria plans. Hint, hint, financial wellness is critical to that perception, because without proper communication, employees can view the cafeteria plan as a way for employers to pay them less. So again, this is where HDHP and CDHPs really started to see some negative press, so to speak, because of the perception that the employers were just having to pay less for their healthcare coverage. So there are a couple other characteristics of Section 125 plans that I want to make sure that I cover. Cafeteria plans are not all the same. There are a couple of different variations that are allowed under Section 125. I'm not going to test you on that component. They're given their name because of that cafeteria style in selecting benefits for themselves and for family. That's not to be confused with some of these flex credit programs that are being called cafeteria credits or cafeteria benefits. So be mindful that that language is being used interchangeably in a horrible way. And even though that we've got different types of Section 125 plans, the only means by which you can receive this type of tax-favored benefit is through a cafeteria plan. And then cafeteria plans have to have a written plan document, or you can't do the tax-free treatment. And so there's a lot of rules that go along with Section 125 plans that we're going to jump into, but that written plan document is key, and if it's not done right, it can be catastrophic to the plan and the benefits. So what are some of the provisions that have to be in that document? Well, the specific description of each benefit has to be listed, the period of coverage for the plan, the rules governing the employee's eligibility and participation, and this is going to come back to something that we're going to call non-discrimination testing here in a moment. Procedures for making the elections under the plan, what's the process that the employee goes through? The manner in which contributions can be made. So how does an employee make that? Do they enter into a salary reduction agreement, etc.? What's the maximum amount of employer contributions available to any one participant? Again, this is going to circle right back around to our non-discrimination testing. And what defines a plan year? So Section 105 and 106 of the tax code really jump into what kinds of plans are covered under that umbrella that I mentioned earlier. So these are the most common: health and medical coverage, including prescription drugs, dental and vision plans. And I would say I actually self-retain my dental. I don't carry dental insurance. It wasn't cost effective for what they were offering. So I actually just put more in my FSA and just pay for my dental expenses out of my FSA. And some people I know will self-retain their dental and vision, run it through their credit card, submit a form to get reimbursed from their FSA. And then there's, some of them have point systems, so they're just getting the points, the percentage back on their credit card, some sort of reward program that they have on their credit card to double up and get points from while simultaneously getting the tax benefit from their FSA. Accidental death and dismemberment coverage, business travel accidents plans, some hospital indemnity, cancer, and Medicare supplements, all covered under Section 125. So there are additional qualified Section 125 benefits, such as group term life insurance that I mentioned on the first slide. And as I said, the first $50,000 is not subject to tax, but beyond that, you fall under a different area of the tax code, and you would have to pay taxes on that above the $50,000. Employer provided dependent care assistance and adoption programs, and as I mentioned, dependent care FSA caps out at $5,000. If you file individually, I think it's like $2,750 that each person can get to claim for dependent care assistance, and then adoption assistance. Contributions to your 401k, of course, are covered under Section 125, and contributions to your HSA. So again, the tax benefits that you have on that investment product as well. And then healthcare expenses under the flexible spending account. So these are all things that are covered under Section 125. So some benefits that are paid through a cafeteria plan are actually taxable. And a taxable benefit is one that results in taxable income for the employee when it's received, and a taxable deduction for the employer when it's paid. So let me give you an example of that. So with disability benefits, if I paid for that benefit with after-tax dollars, meaning I paid taxes and then I paid the premium on that, then the payout, if I find an event that's qualifying under that disability, is not taxed. But if I paid the premium for that disability benefit with pre-tax dollars, then my disability payments would be taxed. So this is for for example, for disability insurance. Of course, there are benefits that are prohibited from cafeteria plans: educational assistance, long-term care, athletic facilities, employee discounts, meals, and financial and legal assistance. So a quick rundown of the things that you don't get to have covered under Section 125 plans. I think the only thing I really want to point out from this slide is the premium only plans, again, cover the employee's contribution to the company sponsored plan. So if I'm paying, $400 a month for Blue Cross Blue Shield insurance coverage, I can get that my premium taken out on a pre-tax basis. So the Marchino book goes into different types of benefit plan arrangements, and I really just want to focus in on that mix and match plan where employees have the option to purchase benefits with flex credit. So that's a really popular model right now. And if you think about not even the millennial generation, but as we approach Gen Z and some of the later millennial generations, I mean, the needs of millennials are very different than the needs of Gen Xers and baby boomers, and so the freedom of choice seems to be very popular among employers, and then of course by employees. Some of the challenges with flex credit concepts is that if I'm a 20-something year old non-Appalachian graduate, definitely didn't graduate out of the College of Business, but I come into a job, I may not know that I need to invest in a 401k, but everyone in Appalachia knows that they need to be investing in their 401k as early as possible, particularly my RMI and finance and banking majors. But not everyone knows that they need to invest early to maximize that 401k. So if I'm 20 something years old, I may say, hey, I'm just going to go ahead and get pet insurance and get, all these other benefits that are beneficial to me now, but may not have that long-term benefit. So then when I'm 20, 30 years down the road working, I may not have saved up enough for my retirement, and that puts an employee in a different position altogether. Sometimes with flex credits, employees don't really know what they need, and so they might be going off of Google, misinformation. So any company that offers flex credits really needs to have a solid open enrollment process and really robust financial wellness for their employees, in my opinion. Completely my opinion. The basic gist of this is letting you know that there are certain types of people that don't qualify for Cafeteria 125 plans. And again, not something I'm necessarily testing you over, but self-employed individuals, people that have a greater shareholder in a S corporation, again, are ineligible to participate in a cafeteria plan, but they can still offer it for their other employees. So you may say, well, what are eligible employees? Well, eligible employees would include present or former employees, leased employees, and I've never heard of leased employees until now, full-time life insurance salespeople, common law employees, whoever the IRS defines as an employee could be an employee. Spouses and dependents can't necessarily participate in the cafeteria plan. However, the plan can be providing benefits to the family if it's elected by the employee. Of course, this is a bit of an outdated rule, but it used to be that domestic partner relationships and same-sex partnerships back several years ago could not be covered under Section 125 plans. Of course, a lot of that has changed, definitely in the recent years. So in lieu of paying compensation to an employee, the employer contributes the amount that's agreed upon towards the cost of the benefit. The employee can pay for the benefit on a tax-favored basis, and the employee is buying the benefits on a pre-tax basis. So for this agreement to be valid, it has to be entered into between the employer and employee prior to the beginning of the period of coverage, which is usually the planned year. So sometimes employers provide an annual automatic enrollment for their employees certain benefits under a cafeteria plan. So that automatic enrollment is known as negative or passive enrollment more commonly. So an evergreen election is similar to a negative and passive enrollment in that an employee just makes this one-time election, and that election rolls over from year to year unless there's a need to make a change. So this really helps with administrative issues in having to have employees re-enroll in their benefits every single year. So what are some of the things that prompt a change in status under a cafeteria plan? Well, if your spouse was carrying healthcare coverage and they lost their job, so then you might be able to elect and get into the healthcare insurance that you have in your company and elect for these Section 125 benefits. Birth of a child, marriage, adoption, divorce in the same way would also allow for you to have a change in election. So again, all of these are subject to other acts like FMLA, the HART Act, and USERRA. And USERRA and the HART Act deal more with military families and benefits. From a procedural perspective for a flex spending account, I actually have a debit card that I use for my flex spending. And occasionally I'll get an email from the flex spending TPA. It'll say, hey, you charge $400 to your chiropractor. Please send us documentation. And at any point, they can ask for documentation for anything that I put on that card. And so that claim has to be substantiated before it can be reimbursed under the FSA. So if I was sending in a fax copy or mailing in the form, I would mail it in with a receipt that would itemize and explain what the FSA reimbursement request is for. FSA account funds that are not used can be retained by the employer, used to pay plan expenses, or can be given to a charity. Those are the only three uses for FSA funds that end up in the use it or lose it account. And again, with dependent care FSA, it's a little bit different in that, remember how I said with FSA, your money is available to you day one of the plan year. So if in October and November, I elect for $1,000 of FSA, I would have access to that full $1,000 in January. Well, in dependent care FSA land, that money is available as it's incurred. So it's similar to the HSA, is as you contribute to it, then you would have access to it. And so again, this is so that the employee and the employee's spouses can work or look for work. So they must be reimbursed by a licensed child care or elder care center, or it has to be someone who is at least 19 years old and paying taxes on the money that you're paying for them. So it doesn't include, babysitting for social events, education expenses, or overnight camp expenses. And the employee has to declare in a written statement by an independent third party confirming the expenses that have been incurred. So every year I get a full printout of all the expenses coming from the child care center, and it has their tax ID and it itemizes what those expenses are for. So, some things would not be covered, but the tuition to go to the center would be. The non-discrimination rules are pretty important because cafeteria plans are subject to a variety of complicated non-discrimination tests that can apply as a whole or to certain groups of underlying plans. So in terms of the overall tests that apply generally to cafeteria plans, there are 3 tests. So the first test is the eligibility test. So the plan may not discriminate in favor of highly compensated individuals as to the ability to participate. Contributions and benefits test basically says that the benefits must be made on a non-discriminatory basis, meaning that highly compensated individuals cannot select more non-taxable benefits than non-highly compensated individuals. So that's something that the company has to keep track of and be able to provide data to support which benefits are going to which type of employees. Then there's the key employee concentration test. The plan's key employees' contributions can't exceed 25% of the total contributions into the plan. So again, this is a way to keep a disproportionate number of your lower paid employees from being able to access the Section 125 plans. And this is where some of the insurtechs are really starting to develop. And you say, well, why is insurtech developing in this area? So a lot of those who produce tools for self-funded plans also produce tools to measure information for non-discrimination testing at the end of the year. So the unfortunate thing about non-discrimination testing is that an employer really won't know how these tests pan out until the end of their plan year, but they can do some predictive modeling in the quarter 2, quarter 3 to determine whether or not they're on track to perform well under these tests.